Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host. And today we are talking about high yield topics when you're studying for your dental hygiene exams. Same concepts will apply no matter where you're at. If you're studying your prerequisites, you can still use these tips to help you perform better on your exams. All right. So if you've been listening for a while, you know, we talk about study strategies, and I've mentioned in the past studying for high yield topics, not just focusing on every last detail, because if you try and do that, you probably will drive yourself crazy. At the same time, there are some details that inherently we will just know and understand, right? There's a level of logic that we all have that as you're reading material, you're like, okay, 2 and 2 make 4, right? That makes sense to us. But there are these high yield topics that will show up over and over again, that will be repeated, that will be spread across different classes that you take. And if you can start to recognize the connection between those topics, you have found the high yield topics, and you're going to see what you really need to study and spend the bulk of your effort on in order to perform your best in dental hygiene school. Yes, it would be amazing to score a 100 on all of our dental hygiene exams, and I wish that beautiful future for all of you. But I want you to keep in mind that it is impossible to really know everything, and it's impossible to know everything that your instructors are going to throw at you. You will probably get an off the wall question, at least 1 or 2 on your exams. Maybe you'll know them, maybe you won't. But if we can get you to the point where you know the bulk of the answers, that is the most important, right? Like striving for perfection, I'm not against it. I'm that person myself. I want to push myself to be the best that I can be. But at the same time, just for example, the national board exams, 350 questions. It could be 350 questions. I have no idea where they're coming from, right? I cannot know every tiny detail about every single subject, right? It's just impossible. And so if we go into a test with that mindset that I know the bulk of the information, I'm also okay with the fact that there may be some questions that I don't know, but I know I put my time and effort into the most important concepts that are really going to be heavily tested, and that I know are going to benefit me out in the real world as well. Coming through it with that mindset is going to be very helpful for you. Okay. So what does the term high yield actually mean? First things first, it shows up repeatedly. Okay. So, the example I give is diabetes. Diabetes, oh my gosh, you'll learn about it in every single class in dental hygiene school, right? So if they're talking about diabetes, I'm like, I should pay attention to this. Okay. But if you start seeing concepts showing up again and again and again, that means it's material that you need to know. The other thing is if it requires application, maybe outside of just memorization. So think about blood pressure guidelines, think about staging and grading guidelines, think about ASA, think about vital signs, right? You have to know those, right? There's a knowledge component. You have to know it, but you also have to be able to apply that when you step into the clinic. Those are high yield concepts, okay? And what I'm talking about now, I'm speaking about it in terms of studying for dental hygiene exams. I am also speaking at this from the level of preparing for national boards, okay? So if you can understand this concept early in your dental hygiene school career, then what you're going to see is you're going to build and start to really recognize how to study for these high yield topics. It's going to impact your scores. It's going to improve your scores throughout your entire dental hygiene education. And we're going to see the big ticket item, your Super Bowl, the national board, where you come back and you crush it because you recognize the high yield, you recognize the patterns, you see that each individual puzzle piece links together to create an entire puzzle of dental hygiene related knowledge. Okay. Other things that are high yield topics, if they affect patient safety, if they affect your clinical decisions, those are going to be important. And then, of course, as I said, if they connect to multiple courses or competencies, those are going to be important concepts as well. So one thing I want you to remember off the top of your head, just to kind of get started, early in your dental hygiene school journey, you are on a knowledge journey. Okay. So knowledge is just memorization, basically. It's like, do you learn this material and can you reproduce it? So just think about pre-clinic days. You're learning about the different types of instruments, where they're used, what type of calculus they're used on, right? That is all knowledge. Okay. Where are you going to apply that knowledge? You're going to apply it in the clinic, right? So you're taking it up a level when you start treating patients. The other thing is, where are you going to apply that knowledge again? You're going to apply it when you get into periodontology, because you're going to be assessing disease, right? With your probe, you're going to be looking clinically. And then you need to understand what the different types of diseases are. So we start to see this framework build out where the knowledge that you learned early in your education, you're building on it so that you can apply it and think critically, right? So that by the time you get to the board exam, you should have kind of a well rounded knowledge, application, critical thinking. Like it's all tied in together because you've been building it from day one. So, a couple of things. How are we going to build out this knowledge, application, critical thinking, and how are we going to focus on these high yield concepts? Listen to your instructor's language. Okay. I said this before, I'll say it again. Pay attention to your instructors when they are speaking in class and clinic. They are telling you what is important. If you're not listening, you're not obtaining that knowledge. Okay. If your instructors are saying things like, you're going to see this again, this often shows up on board exams. I expect you to know this material moving forward. This is a board style question, right? They're verbally highlighting what they want you to know. Same thing may be true on their PowerPoint slides or their decks, right? It may have something outlined in red, underlined, right? They're trying to tell you what you need to know. If you are avoiding those things or you're not paying attention to those cues, you've already set yourself up for maybe not failure, but to at least miss some high ticket items, okay? The next thing, look for topics that cross multiple classes. We talked about things like diabetes, right? Perio. We come across that in every single class because that's what we're designed to treat, right? Even things like bacteria, they play a role, transmissible diseases. We see those things coming across multiple different classes. The other thing, and this is something, oh my gosh, I wish my students could wrap their brain around. Pay attention to what's tested more than once. Oftentimes, you're going to have quizzes, right? Maybe homework assignments. If you see things repeated on quizzes or homework assignments, you better expect that you're going to see them on the board exam, or excuse me, well, the board exam probably, but also on your midterms and your final exams, right? Your bigger ticket items. Keratinized tissue. So your attached gingiva, your hard palate, and then of course the outer lip, which is keratinized. Okay. I told my students that I tested it on almost every single exam and quiz in that class. And by the end, people were still getting it wrong. So that is telling you that those students were not taking the opportunity, one, to recognize what keeps coming up over and over again and that it's important because things like that do show up on the boards. That's why I kept testing it. I was like, you've got to get this in your brain at some point, right? So if it keeps coming up over and over again, they're not doing it to be mean. They want you to learn it. So as you're reflecting, think about, oh, this question was on my quiz. It's here on my exam. This is important. I need to learn this material. Take the opportunity to go back and truly learn it, okay, until you know it. Don't forget to practice with practice questions, and use them as a map and a guideline. You don't have to worry so much about how you're scoring when you're practicing. I want you to use them as a marker for how you're performing and to find areas that you're struggling so that we can go back and spend more time there as well, okay? That's another way that you're going to study the high yield topics. It's focusing on what you don't know, not repeating constantly what you do know. Okay. If you're just getting all of them right, all of them right, all of them right, I mean, that should make you feel good, right? That's a marker showing that you are on the track to success. From there, you're like, okay, you can walk into the exam feeling more confident because you're constantly getting practice questions right. However, if you only study practice questions, and I see this all the time with the boards, people will be like, well, I just kept doing practice questions. I probably did 10,000 practice questions. I did them over and over until I knew every answer to every practice question. I'm like, well, you memorized the questions. You didn't memorize the material, right? So you start to see that there's a little gap in the knowledge because you did not connect where that material was learned, why it was important. All you knew was the question, right? And if the question is worded differently than the way that you studied it, you're going to have a hard time getting it correct. Okay. So there is a difference between studying and using practice questions to test your knowledge or using practice questions as your study method, right? So I want you to do the former. Lastly, I want you to think about yourself as a clinician because you are one and you will be, right? As a dental hygienist, I don't want you to think about yourself as just a student. I really want you to ask yourself, how would this scenario affect patient safety? How could it play a role with their medical emergencies or their medical conditions or their medications? Could this change treatment planning, right? How are these things interconnected? This is really what you need to do on the clinic floor is start playing Sherlock Holmes. This is going to help you recognize high yield concepts, right? Because again, everything you do in clinic is a direct correlation to one, what you're going to be doing in real life, two, what they love to test you on the board exams. Okay. So keep that in mind that you need to understand the process of care. How do I walk through each step? How do I assess my patient? How do I diagnose my patient? How do I treatment plan? Those things come with time, but you are learning the foundation of that in every single class that you're taking, whether you realize it or not. So as you're learning material, start asking yourself, how would I apply this information to a patient scenario, to real life? Think about how you're going to utilize that and maybe how you would explain that to your patient. If you can explain it out loud to somebody, that means that you truly know the material. Okay. Last thing I want to mention, just because it's the hardest topic does not mean it's the highest yield information. And I know that's really hard for us to wrap our brain around. So maybe like, this is the hardest thing I've ever learned. And there may be very few questions on it on the exam. A perfect example of this is histology and embryology is not extremely heavily tested on the board exam. Do you need to understand key aspects of it? The high yield concepts? Yes. Like you need to know tooth development for the board exam. And you learn that in histology and embryology. But there are some things that, while it's good to understand them in theory, like you don't need to really truly know them in deep detail for the boards. However, when you're taking the class, you do have to know them in detail. So you're still going to learn it, right? But some of these high yield topics, they are simple but critical. The perfect example is the blood pressure classifications. You would not believe how many students get blood pressure classification questions wrong. It's not that it's hard, it's just that you have to know it like the back of your hand. Okay. So if you're getting stuck and you're like, what should I study? Right? Ask yourself, if I only had 48 hours to study, right? The exam is in 2 days. Where would I put my energy? Where would I put my focus? You need to look through the material through that lens, right? What did the instructor say? You need to know this for the exam, or what are we implementing in our homework assignments and our quizzes, right? Those are high yield topics. If you only have 48 hours, you need to put the time into those topics, right? With that being said, I am a firm believer in no stone left unturned. So you still want to review the material that you've been given for the exam, but I want you to spend the most time on those high yield concepts. Okay. So it doesn't mean you can just disregard the other things, but we want to put the most amount of energy into the most important topics. Okay. That is how you're going to see your exam scores improve. That's also how you're really going to start connecting the dots between your classes as well. All right. Best of luck on your journey, future registered dental hygienist. I appreciate you so much. If you are struggling, no matter where you're at on the journey, head down to the show notes. I created a special free document for you. It's called Overcoming the Dental Hygiene Hurdle. You can find it in the show notes. I just want to give you guys something that helps you feel a little bit like you're not alone on this journey and gives you some, tips and tricks for how to overcome struggles that you're dealing with in dental hygiene school, no matter what that struggle is. This little document is for you. So head on down, click on that, and you'll also be added to our newsletter. So our newsletter, it comes out every week, but we give lots of tips and tricks for how to be successful in dental hygiene school and beyond. All right, everybody. Thank you so much for listening. Have an amazing day.